All right. Nobody likes the front row. Except for Wayne. He's silent in here. All right. I'm going to get a beverage and right back. So thanks for being here today. Yeah. I got a little mini setup, so bear with me if there's some technical bumps, but we'll get through it together. And yeah, so neighbors, I'm assuming I'm originally from Campbell area, born in Holy Spirit Hospital, went away to school, came back. That's the short version. Anybody from more than that little way? No? Well, maybe recently. No, okay. Where are you from originally?
Houston, Texas.
Okay, yeah. A little further than Campbell. Yeah. Well, welcome. I'm going to jump right in. We're here to talk about neuropathy today. Before I do, love or hate him, Robert Kennedy Jr., we got the same vocal thing going on. So if you need to repeat something, let me know. It's the end of the day. My voice is a little retired, so I want to make sure you get the information today. Is that fair? Okay. Who knows if they've already been diagnosed with neuropathy? Okay. Most of you, all right. Sometimes you're just learning about it or whatever, but that's helpful to know who we're talking to today. So my goal today really is to get clarity on what's possible and maybe where you're at in your journey with neuropathy. Okay? So we get to see fun stories like this as well. Before I was in pain, 2 treatments down, and I have some balance. Most of the pain in my right side is gone, and my left side is improving. Who's been told they have to learn to live with neuropathy? You're just not going to get better. You've been told that. Yeah. I'm here to show you maybe there's another way. Okay? So hang in there. We're going to actually give a live demo for one of you guys today, and you can see what it's like in real time. Okay? So, just to be clear too, this workshop is not for everyone. If you're looking for quick fixes, this is not it. If you're looking for another pill or another surgery, this is not it. Okay? Most people are tired of that anyway, but just to let you know, like if you're going, hey, fix me, doc, that's not how this works. All right? But really if you're tired of managing symptoms and you really want to get to the bottom of what's going on, that's what we're here about. That's what we're here for, and that's what we're explaining over today. Okay? So, I want you to walk away with some clarity is a big thing, understanding what's really causing it, what may be reversible and what's not, and see how nerve health is objectively measured, and then what are the best next steps with confidence. You go, okay, this makes sense for me or it doesn't, right? Clarity gives you, clear path. You're not guessing anymore. Where am I at? What's going on? How do I proceed? Make sense? So that's what we're going for. If you're dealing with neuropathy, you're not weak. You didn't fail. There's things that are systems that are broken, and they need support. Okay, 20 million people in the U.S. are dealing with this. It's 1 in 4 people over 1 in 6 over age 45. Got my numbers a little backwards there. So 1 in 6 people over age 45 are dealing with this. Can you catch it? It's not communicable. Why is this such a big deal? We'll talk about that here in a minute too. Okay? So, traditional models. What have they given you so far? Nothing yet? Just watch and wait? Any gabapentin, Neurontin, nothing like that's been prescribed yet? Good. Let's try to keep it that way. That's the most common one that I hear is basically medication to start managing symptoms. Basically, they don't pain. They don't actually improve nerve function at all. In fact, they make it worse. You need to be aware of that. One of the main problems with neuropathy is blood flow constriction in the tissue. And Neurontin and gabapentin, for example, will actually make that worse over time. So just if you're not on it, I can't tell you to take it or not take it, but just in my opinion, usually better without it in terms of healing it up. Does this make sense? So,
Question. Is that the same for like teas where they say like certain teas reduce inflammation?
yeah, like turmeric and ginger, that are like herbal teas, up to me.
Mm-hmm.
Yeah, absolutely. And you just touched on a really important point we're going to get to in a minute. So, no, it's great. I love that. You're already like ahead of the curve on that. But yes, there are certain definitely dietary things that are really important to make the chemistry work right in the body.
There might be even with part of the like teas or stuff like the way the medications.
Oh, correct. No, not in terms of like teas or herbals. I mean, the caffeinated stuff is going to do more of this. So I guess we can jump right to that piece of it, like what causes neuropathy. If you put your hand like this for me, this is your nerve cell. Probably want to get a drink. That's your nerve cell. These are the blood vessels that feed that nerve cell. Okay? If you're going to squeeze that as tight as you can for 15 minutes, what are you going to feel? Pain. Yeah. Numbness, tingling, all the things that go with neuropathy. Right? When you start to choke off the blood supply and you start to suffocate the nerve, it starts to let you know. So anything that does this is going to be making your system or your situation worse. Does that make sense? So that's what, so like herbal teas like ginger do this. Turmeric can help as well. Caffeine. Make sense?
Gotcha. Yes.
So that if you think in those terms, that's going to be a helpful concept you can apply to anything you're doing. Okay. Yeah, decline is labeled normal, but like heart attacks, common or normal? Right? Common. Doesn't mean it's normal. So I don't like that word normal. It's just that it does tend to decline with time if it's undertreated or not treated properly. And nerves don't die from a lack of drugs, they die from a lack of nourishment. That's the same idea with the hand, right? So that's what we're going for there. All right. So again, goal for you today is going to be showing you natural ways to heal, get 50 to 100% improvement in your situation, even when other resistance or treatments have failed. So that's like a, yeah, right? Who's thinking, yeah, right? So I invite that and skip this into we're to show you what this looks like and why that is actually potential for a lot of people. So what is neuropathy? It's basically damage to your nerve system. The central nervous system is the brain and spine. Everything else is peripheral. So most commonly you're going to see it in feet and in hands, and then you might even have it in face. It can affect your GI, it can affect a lot of different systems, but most commonly people experience it in their feet. Anybody experiencing that yet? You notice it in the feet, yeah. That's 80% of it. But it's basically damage to your nerves that are lower in the periphery, right? Not in the central. And then you see things like you start losing quality of life. Balance becomes an issue. Steps, like that was my anniversary trip a couple of summers ago with the Finger Lakes, and I thought, man, my patients on this side of the fence would hate to even try that, let alone you miss the beauty on the other side. And so you stop doing some stuff you love, or it slows down, right? Has that been your experience too? You hear that all day long. So that's a big deal. So next is like, we talked about this, right? What causes this? And there's some major players here. We mentioned that you're going to feel symptoms of burning, tingling, numbness, weakness, like all these things that go with neuropathy symptoms. And we can just sit there and use medication and paint the leaves green again, right? Or we can fix the root. So the root causes are more related to gut health. Over half of your immune system is in your gut. So if that's off, that affects everything from an inflammation standpoint. Macronutrients, that's like your carbohydrates, proteins, and fats. Most people eat too much what in our country? Sugar. Yeah, sugar, that's the carbohydrate side of things, right? Your sugar will damage your nerve real quick. Okay? Micronutrients, that's like B12, folic acid, lipoic acid, magnesium, all the things, the nutrients your body actually needs to make the nerve work properly. Oxygen deprivation, if you have a lung problem or something like that, that can contribute. But definitely if you're not moving around, sedentary lifestyle depletes that. And various things will cause oxygen debt into the tissue again, suffocating that nerve, and then doesn't work so well. And then underlying neurological weaknesses could be from an injury or a trauma. I had a gentleman with a gunshot wound to the backside, and we couldn't get that one fixed. The nerve is shot or damaged. It is what it is. And other ones are like genetically induced neuropathy problems and the nervous breakdown for genetic reasons. So those are some underlying issues. And again, if we can support what's happening here, we see the leaves start to change. Just like if you had a plant and it's wilting, what do? Water it. You change the soil, put some good nutrients in there, right? Sunlight, change the environment, and then the plant has an opportunity to come back. If it's too far gone, you can change all that stuff, and what's going to happen, Andy? Yeah, nothing. The plant's done, right? It's too far gone. So the nerves are similar. If that nerve is past the point where it's too damaged, that's when there's not really a lot of help left for it. Okay, and that's what we try to figure out in our process. Does that make sense? Okay. So, in our experience, there's three main drivers that show up again and again and again, and they are this: circulation and oxygen delivery. We kind of talked about that. Breakdown in nerve signaling. Some people have a pinched nerve in the back, or a bulging disc, or something like that, or damage in the actual nerve. If the signal can't get there, you're not going to feel it. Make sense? And then chronic inflammation, to Heather's point, bing, 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 that's a big one. So if we don't tackle those three or address those three, that's when things don't get solved. Which one can medication help? Sometimes a little bit on inflammation, right? There's anti-inflammatory meds, but do they solve what's driving inflammation, or do they just kind of put a little bit of the fire out?
Kind of massive.
Yeah,
What else they're causing on the other side of
right. Yeah, it's not actually going after what's causing the inflammation. Right, we just got gut health and all those other things we just mentioned a minute ago. So yeah, good thought on that. Yeah, if those aren't addressed, then nothing really sticks. So the biggest mistake I see people making is that they just guess at where they're at. They guess at, they're just treating blindfolded. Or they might do one test at the neurologist and they say, oh, you've got neuropathy, but no one ever gave them a score. No one actually measured the severity. And then they, whatever the treatment options are at that point, in the standard medical world, there isn't much available other than medication. Until you qualify then for surgery, which is, I'm not a fear tactics guy, but you do need to be aware if you're type 2 diabetic, then you're in a higher risk category for amputations, and that's real. I've seen actually a lady sitting here last year where Heather was, and she literally lost 3 toes on one foot, and they're going to take some on the other foot. It's broke my heart because we could have gotten to her sooner. We probably could have helped save some toes or a foot. One of my best friends, he lives in Atlanta, and his brother, severe diabetic, they literally took his leg off. This is not a joke. So all that to say, if we can measure it, find out where we're at, then we got some options. Yeah, you can't fix what you don't measure. So real outcomes, you see in the right conditions. So we're talking about the plant model, right? Same thing. We see better balance, we see reduced pain, we see increased confidence. Can your neuropathy improve? That's the question. We don't know. That's what we have to figure out. But when you address the roots, and like we said, that inflammation and right, all those the nerve flow, etc., we can see really cool things happen. So I mentioned a couple people here. Leroy, he got 50% better in 90 days. He's a painter. pretty much had to quit what he was doing because he couldn't balance on ladders and things like that. And he was diabetic. He would not give up turkey ale sweet tea. He said, I'm just not going to stop drinking that, doc. I'm like, it's your foot, dude. Like, I can't cure more than you do. But he still improved a significant amount, even though he wasn't perfect. So I mentioned leeway because you don't need to be perfect to make headway or progress. Okay? I can now feel my toes for the first time in 5 to 6 years. Similarly, that's a little smaller. I can feel my feet for the first time in 10 years. So even though it's been bad for a long time, if the nerve isn't too far gone and we can measure that, and there's, get the right treatment in place, you can see miracles happen. LC, her balance was horrible. Her husband would drive her over an hour to get to her appointments. And now we never see her because she's fine and she's got better things to do in my office. So that's our goal, is get you better and let you live your life. So, yeah, we can't take every nerve. A lot of them can be reawakened. You can't always promise miracles, but we will promise honesty. And it's sad to say these days you don't always get that, but we're going to shoot straight. The earlier the intervention, the better the outcome is, hands down, almost always how that goes. It's like, if your car starts making a noise and you wait long enough, it's going to cost you more to fix that thing than if you get it done on the front end, right? So the sooner you can figure out what's happening and address it, that's usually way better outcomes. So let's show you what this actually looks like. And I'll tell you a brief story before we get to that, because it's like, I never went to school to be an expert in neuropathy. It was never like, sign me up, that's what I want to study. Did you ever learn through the school Hard Knocks, anybody? Right? Yeah, so that's been my journey with this. Well over 10 years ago now, my dad was a Vietnam veteran, served 2 tours. And he had Agent Orange exposure, which is a neurotoxin. He also had blood sugar problems and heart disease stuff was in our family line, and so he was dealing with some of that. Started losing his balance. His feet weren't in the stage they were. But, he's a tough guy, can handle it, right? He's been through a lot. And he also didn't want to put any burden on the family and go, I'm dealing with this, and then he wanted, what I mean, like that unspoken, I'm going to put pressure on this, I can still deal with it. But then our neighbor was having a litter of puppies. And he went up to the shed, second story shed, and got the kennel to help out with the rolling box. And as he's coming down the stairs, he lost his balance and he fell. And he ended up breaking his neck. Yeah. And that completely changed our world. And so I'll never forget driving down to the hospital and seeing the films, and they're like, we're doing the best we can, doc, but these are the ones you never want to see ever, let alone your own family member. And going, but he ended up in a C5 quad, which means he was in a wheelchair. He had a hard time feeding himself, couldn't really hug his kids and grandkids much anymore. So it completely changed our world. So balance is a big deal for that reason. And if we can start to help you understand where your balance is at, and if all of you guys are feeling your feet, we're going to do a couple screening tests to bring some awareness for you for where your balance is at. Okay? So, and then, right, so we looked at what we do for housing for him, right? It's like, goodness, 10 years ago, we're putting it's a 2-story house, ADA compliant first floor bathroom, or, master with basic, contractor grade stuff was like $50,000. 10 years ago, it's probably triple that now. So, to say we've lived through every aspect of this, the emotional, the physical, the financial, like all of that, I get this at a core level. And so we can do anything to support you. This is what we're here for. We don't have a big budget like Big Pharma does, right? We do these one at a time, person by person, just sharing the story of what's possible. So thanks for being here on that. So if we ever seem, I don't know, pushy, I don't think I'm a pushy guy, but if I know that I'm confident, don't take that as pushy, right? If I go, I can help you, I'm going to do everything possible to make that go. Is that fair? All right, so with that in mind, let's have you guys stand up. Get a little blood flow going here. And we're going to check balance. I'm going to show you the tests. You don't need to do them right away. I'll walk you through and then we'll go as a group. Okay? The first one's going to be all of them are going to have hands on the hips. And then we'll start with our feet as close together as possible. And don't close your eyes now. But you'll close your eyes to start. Okay, we'll do it for 10 seconds. And then if you fall down on that one, we got bigger fish to fry. Okay, that's a bigger issue. But that should be baseline. And then from there, the next one is going to be hands on the hips with one leg up. You'll sit on your strongest leg. We'll do that for 10 seconds. You pass that one, guess what the next one is? That'd be a great idea. We'll just skip that and go to eyes closed.
Okay.
Yeah. So you'll stand on your strongest leg and just eyes closed with the third one. Most people get, drop off in that midsection. So, yeah. And we've never had anyone go down yet. So look at your neighbor and say, I got your back. Okay?
I got you guys.
Yeah. And if you, seriously, if anything feels uncomfortable, you're like, this side, no, I'm not passing this one, then don't even, you don't need to be a hero. Okay? So, hands together. Or hands on the hips, feet together. And then when I say go, we'll close eyes for 10. In 3, 2, 1, go. And that's 10 seconds. Good job. No one fell over. Okay. Who felt 10 out of 10? I can do that all day long. Not a big deal. And 0 is I'm about to fall over. Somebody catch me. Where would you say you're at on that spectrum?
8.
Further in the middle,
Yeah.
and you're an 8, so pretty solid there. You're pretty good too. What'd you notice, Andy?
I know.
So middle ground for you guys. Okay. So what I've noticed with that is that even though this one you passed it, there's still that like back of your mind. Can I negotiate this there? Is that like it doesn't? You don't really think about it, but it takes energy in your mind all the time. A little extra guardedness is what I usually hear with that. So yeah, thanks for sharing that. Let's do the next one is hands on the hips, and we'll do one leg up, stand on your strongest leg for 10 in 3, 2, 1, and go. If the foot touches at all, it's a fail. And stop. All right, who passed that one? Not Wayne. I saw that one touch a couple times, but you were trying, buddy. That's a good deal.
I don't have neuropathy. I'm here for support.
That's okay. Support's good, but still, what did you notice?
A little shaky.
A little shaky, but you made it.
I made it.
Awesome. Andy, how'd you do?
Good.
Yeah, you passed that one? Awesome. Jim,
Yeah, I touched.
not so much. You touched. Yeah, okay.
It'll be worse when I close my eyes.
Yeah, that usually is, right? We need 3 things to stay upright. We have our inner ear, our eyes, and our what we're feeling. And so if you lose 2 of those, you're going down. That's how that works. Yeah. So I guess for the sake of time, we'll skip that last one unless you really want to try it. He's like, let's go. Okay, let's do it. Yeah, hands on the hips.
Dealing with some other stuff, so
Doing some other stuff too. Okay.
yeah.
Yeah. So let's do hands on the hips, and then when you're ready, if you want to try it, feel free. Your eyes closed. I gotta keep mine open to watch the clock. In 3, 2, 1, go. Okay.
Yeah.
That's not. That was. So yeah, close, and she was pushing you over, falling.
I started paying attention.
Yeah, right. So that brings me.
Do you have neuropathy?
Yeah, well, there could be other reasons for that, but that's something you can't feel what you're standing on, right? And the brain's not getting that information, and numb feet, that's a bad deal for balance. Yeah, thanks for playing. Who got more awareness for the balance that with that? Is it better or worse than you thought? Did you notice? About what you thought? Yeah, okay. Gotta solidify that for you.
I kind of got a surprise. It's workers.
Yeah, right? I get that as well too. Oh, I didn't know that was the thing. I don't have neuropathy, but yeah.
Yeah.
Yeah. Good. All right, so have a seat for a minute. We're gonna pick one of these 3 because Heather doesn't have neuropathy. She has other balance issues, but we'll talk about that some other time. Who's had neuropathy for more than say 5 years. Okay, more than 10 years. Not sure. And that's so 5 or so. So here's my thought. Wayne's a little older. If we can support Wayne and see if his body's responsive, then that might translate for someone that has younger nerves. Is that fair? Did I pick on you like that, Wayne?
That's good. He's
Okay.
an older guy. Okay.
Yeah. So we're gonna have fun with that.
Yeah.
And to be honest, just really honoring all that you've been through and giving you some support today.
Yeah, that's good.
Yeah.
The balance has been really bad the last couple of
How's it?
Yeah.
Okay. So a few things to support balance, right? We need our brain, obviously, but you need the strength in the leg muscles for that to actually operate. If the tone isn't in the legs firing right, then you can't regain balance and adapt. So we're going to see how Wayne is adapting with the legs, and then we're going to do some, I want to call it therapy. We're going to add some energy to Wayne to see what happens and if his body's responsive. In other words, can we get the nerves to respond? So we're not treating anything today. We're just saying is there responsiveness in the nerve system. Does that make sense? Awesome. So come on up here, Wayne. Maybe stand here facing our amazing gang. And we're going to check a couple other things too, like range of motion, which isn't necessarily a neuropathy thing, but it can give us information about if the body's changing. Okay. Any shoulder problems I should know about?
No.
Okay. So we're just going to check range of motion. Let this go completely heavy, nice and easy here. And so he gets a little bit, almost to 45 on that one. And let's try this one here, nice and soft. Yeah. So similar. Yeah, any pain with the Winston? I'm not trying to hurt him, but just sometimes. Yeah. Okay. Yeah, so some restriction in the shoulders. And then if you notice, this right one's a little higher than the left one. And so what that tells me is usually the muscle that holds that down, it may not be firing as well. So we're going to test that muscle. Turn this backwards here, pull that elbow into your waist, hold that in tight. I'm pulling out, don't let me.
Okay.
Yeah, and that one doesn't engage. So he's contracting it, just doesn't want to stay put. Let's try the other one here. Thumb backwards for me there, pull that one in all tight. And see that one I can really lean into, doesn't go anywhere. So we see a difference, right? There's asymmetry in how that's firing. That's just easy to show in this context. So if you have a seat right here for me, balance-wise, let's do, which one was, you said this is a 5 and one leg, let's time that one.
Want me to?
Yeah, I'm going to time it specifically. So hands on the hips, strongest leg is which one?
Yeah.
Okay. You know better than I do, that's for sure. We'll pick one. We'll so
And you want my eyes open?
eyes be open.
Okay.
Yep. In 3, 2, 1, go. Okay, so he got, we'll call it 6 before he hit the floor, even though it was a good right his hand down. So if we can get anything north of the 6, we need some changes, right?
Yeah.
Let's have a seat here in the chair for me. And now I'm going to check, question, was that a hand or?
Yes.
Yeah.
Are you right or left-handed? And does it matter, like,
Good question.
because he had
And
more strength in his
Uh-huh.
left than his right. So
Correct.
it's primary
that
left
is
or
not
right.
a handedness issue.
Right.
You're right.
Yeah, that's not a handedness element. But great thought.
Okay.
Let's do this. We're going to check the stair climbers and all those stabilizers. So you raise your knee up into my hand here. That one's in good shape. Pull the heel back for me. That one's all right. Point the toe down. Pull the heel back. So that's the calf. So you point your toe, you can feel your calf contract more. And your toes up kind of takes it out of there. So we have a hamstring and calf. His calf's not firing as well. You notice that it's a little weaker? Yep. And then heel on the floor. And yep, I'm going to push down on the top of the foot. Don't let me. And that one's decent. Let's try the other leg here, straight up in the air for me. That one's good. Toes up, pull the heel back. Toes down, pull the heel back. And so both of his calves are saying, I'm not on the job right now. Heel on the floor, and don't be pushing on the top of that foot. And that one was a little more fatigued, right? So this is where you might start tripping over curves or steps on that foot if it's, that's starting to happen for you. So does that change? I don't know. But if we can make any sort of shift in his nerve system, we're going to see things start to re-engage. We're going to go from this to this. Does that make sense? Awesome. So take your socks or at least shoes off for me. And we need socks too, right, Doc?
Yep.
Socks and shoes if you don't mind.
I don't know.
Beautiful.
Stand up?
You can just stay right there.
Okay.
Mm-hmm. So we got a couple things here.
Okay.
Before we turn it on, we'll look up. So if you go on there for me.
Below you here. There we go.
Like that?
This is Dr. Midgley. Dr. Jazzy goes by, and we work hand in hand together. And he's going to be hooking them up on a couple different things. I'll be explaining a little bit what's going on, and then we're not going to talk a whole lot during the session because we really need to. And just let it do its thing, and then we'll see what happens. But the bottom line is we're adding stimulation to those electrode pads with technology that actually rehabs the nerve signaling through the spine.
So you're taking some readings. You can feel that.
Okay. So there's actually no readings being taken. We're not
You
measuring.
feel that. Barely feel that. I feel that.
Okay. I'm not trying to torture you today. We're just
Yeah,
trying to
that's today.
stimulate. Yeah,
That's
that's not
today.
today. That's next week. Just kidding. Just kidding.
So vibration helps with balance and blood flow. You don't push a hand harder, right? What happens when you push the hand over too long,
It's not.
right? That's the wrong vibration. Pushing blood out of the hands. When you get the right vibration in, pull the blood in there, it starts to reactivate the nerves, and actually helps the balance, right? Yeah. The electrodes, like I said, who's heard of a TENS unit before? So this is similar in concept, but it's totally different. TENS is 1950s technology. It does not work for neuropathy. This one will send the signal every 4 milliseconds. It's reading what's going on in the nerve system and changing the signal so it's in real time rehabbing the nerve. Yeah. So that's what's happening. We got one on each foot, so it's going up one side and down the other in the spinal cord. Okay. So we got that going on. You see light going on. Light.
I didn't know that.
I didn't see the light. So the light is great because it restores blood vessels. In the research now, in this little session we're doing here, we're probably not actually getting blood vessels to regrow, right? But the concept is if we can start restoring blood flow back to that nerve, we're going to see shifts and changes in the physiology and how the body works. Okay, so we're adding light energy to the systems that may need extra support. Commonly, brain, heart use a lot of energy, and if they're taking it all, guess what your feet don't get. Does that make sense? So we're supporting that, and then we can also treat directly where you would need new blood flow. If the vessels of the feet, for example, aren't getting no flow, we can actually stimulate to regrow new blood vessels in the extremities. Yeah.
This is certain wavelengths of light.
Mm-hmm. Yep. There's a lot of research on red and infrared in particular. And the red one you can see, the infrared you can't see. They're combined into one.
Oh, so I want to see the red.
And you only see the red. That's our visual spectrum only allows us to see red. Mm.
We're just tracing the nerves and the muscles here.
Oh, yeah?
Shine the
I
light
know
up.
dude does it, huh?
I'm gonna do one more right here.
So this is a demo. When you do it, would you actually be wearing clothes or would you be like, prefer like shorts to skin on?
Actually, so you think about that, you shine a flashlight through your shirt, and you still see light.
I'm thinking a tent, yeah, because if you shine
Exactly.
through a tent, you're gonna see on the other side.
Yeah, so the size of the photon, like the light is gonna go through. So clothing doesn't really matter. When you get like a giant jacket on, it's gonna be less effective than through a shirt, not a big deal. Yeah, is it a little more effective when you do it straight on the skin? Yeah, but you're really not blocking much for that reason. The flashlight tent idea.
Well, this is super high cheekbones and men's clothes can't get.
Jim, fair point. Fair point.
This Jim.
Yeah.
That doesn't go with your medical pass, ball pass. That's not,
You're the kind of guy that wears
does not apply.
the gown opens in the front. You're the gown open in the front guy.
I did
Okay.
that. I did that once in high school. He said, "You got it on wrong with him." I said, "Okay."
I can feel that. Heat.
Yeah.
Mhm.
This one warms up. You'll get some little bit of warmth with it.
Yeah.
Yep.
So is there particular, this technology, you said it's light 10, but it's not.
Mm-hmm. So
Is it
tens only sends one signal out from the
Right.
end. This one is actually reading and changing, modulating. That's the main difference.
Didn't know if it had a name.
Yeah. It's big long
name.
Yeah, it's like digital electrotherapeutic stimulation. Is the yeah. That's so.
No acronym, okay.
Yeah, it's TS or something. Yeah, it's like that's it. Yeah. So the other ones that we like, the chair that you're sitting in is another big helper. So like when your cell phone dies, what do? You put on the charger, right? That induction charger puts energy back into the battery.
Okay.
You know what I mean? This technology that you're sitting on, it's not, we didn't turn it on. Last time I did that in the workshop, I blinked the battery in my computer, so I don't want to do that again. But these mats literally put energy back into tissue, which helps with blood flow, restoring nerve function. Everything heals quicker with energy, right? So that's technology we use when it's appropriate. You may have heard of Tony Robbins before, the international speaker and all that. He sleeps on these before he does his presentations. They make a giant one because it's so tall for everything in it, especially in it. The other one that is not in here, it's in our back room, is the soft wave. It was all over the Olympics. Eagles have these two in their locker room, and it's amazing for bringing blood flow back, increasing your own stem cell production, and a lot of times there's joint issues, knees or backs or shoulders or whatever. It's almost like cheating. It's amazing. Yeah, it's good stuff. Before you put those on, let's remeasure what we did initially
Okay.
and see how we're doing. So stay there for a second, and let's bring, it was the cap. So put your toe down for me. Yep, pull that heel back. That's different, isn't it? Yeah, try the other one. Pull that heel back. And then this heel on the floor. Yep, I'm pushing down on that right one here. That one's still a little mushy.
It is.
Yeah, and so again, we didn't fix everything. but we're seeing that calves are starting to respond. It's pretty fun. And let's see what else we got. So I'm going to stand up here, and we'll check some range of motion again, and we'll check who's weak on this right one here. Thumb in. Yep. Let me get in there for a second. There we go. Yeah, there we go. Now pull that in. And now that one I can lead into as well, and that's not going anywhere. But that will obviously completely. We're going to check range of motion now. Nice and soft. Look at that. That's pretty cool. I'm surprised. I wasn't expecting to see that. You got it on both sides. So when the body feels more safe, right? If you're feeling, and feeling, right? It's a non-conscious thing. But if your body is perceiving that it's not always safe, it's going to lock down more. You don't get as much range of motion. When you change that, and the body's like, oh, now I'm free and easy, and we can play and have fun, and there's more mobility available. Does that make sense?
Oh, yeah. I understand that.
Yeah. So let's do balance and try that again. And we'll do hands on the hips. And we'll stand when I say go on that left leg. Eyes open. 3, 2, 1, and go. So he got to 12 that time. We doubled it. He doubled it, right? That's a what? 1,000%.
Barefoot too.
And that was barefoot too.
100% increase, 6 to 12.
Thank you. Yeah, 100% increase.
Thank you.
On that.
And
So
we did that barefoot too compared to with shoes on before.
right,
Is it harder barefoot?
depends.
It can be. For some people it
Some
is.
people it is significantly different. Mm-hmm. Yeah.
When you can't feel your feet much anyway, so
Right.
yeah, it's kind of.
Yeah. So has anybody seen a change like that before? Right, like this is the kind of stuff we get to play with and support when we start treating the body with what it needs to. We change its chemistry. Do we change any diet? Do we give them supplements? Do we do anything like that? No. We just change input to the nervous system, and it started to respond. Do we get it all better in 5 minutes? No. But can you imagine now having the ability to do that sort of treatment? If you were to do that, say, twice a day for 90 days, and change the diet, and get the supplements right, and all the other support that you may need, you see why we're seeing amazing changes and results that we're getting.
What's a normal session for that red light? Like 15
Time-wise,
minutes? Yeah.
So time frame, typically for a home use, these are averages. Roughly a half hour in the morning, half hour in the evening.
That's a hell of a lot longer than you had on this one,
Yeah,
where we put it.
yeah, we did like 5 or so minutes for the demo, right? To see if there's a response. We're actually treating, okay, here's how bad the nerve is, here's how much we need to treat it. Those are common things that we see. And yeah, those are averages. If it's less severely injured, you might need less treatment time. But the key is the consistency. When I was starting out doing this sort of thing, we were doing it only in the office, and we were seeing marginal results. I knew the science was there, I knew the technology was supposed to work, but we just weren't getting the frequency we needed. And so we've come up with a hybrid model where people treat at home daily, and then we see them in the office as needed, depending on what their case might be. And so that's worked a lot better because, raise your hand if you got something better to do than me in my office. Right? You got nothing better to do than me in here all day long? Cool. All right. Let's hang out, have some fun. But the bottom line is that we can use support. Most people would rather do some things at home to help themselves, and then they've got access to the tools for as long as they would need, as to support their situation. Now, I'll just kind of leave it with that, I think. Yeah. So this is not really about signing up for care or anything like that. This is just giving you ideas on, can my body recover? Is it possible? That's our first question we have to answer. 2 parts of this. We have a discovery day, which are exam day, and we do our measuring the nerve damage, circulation, oxygen delivery, balance, and fall risk. We actually put you on a force plate and give you a number that tells you what your fall risk actually is. Find out what your primary driver is. Is it nerve conduction? Is it blood flow? Is it inflammation? Or what combination of those we need to work on? And then know if improvement is realistic. We're not guessing. There's no pressure with it. Just plain and simple answers. Okay? That's our information gathering day. And then that normally includes consult, examination, or advanced diagnostics. We do all that in-house. Nothing hurts is the other question I always get. It's like, there's no needles, there's none of that stuff. We'll go over, then our second day is report of findings, where we go over all of your information. How bad is it? Can we make it better? That sort of thing. And what's involved in terms of your treatment options with that. Total value for both of those visits is $875. And common questions that I get are, does insurance cover it? And just to be straight honest, Wayne, yeah, no. Yeah, why not? Why doesn't insurance cover that?
I have no idea, but they like drugs.
They do. And really, that's kind of the bottom line, that the insurance is designed to cover emergencies and the traditional system that they got. If they can keep you sick longer, do they make more money? I don't want to go down that whole rabbit trail, but you get the idea, right? The more they keep you on medications, the more you are an annuity for all Big Pharma has to offer. If you actually get better and you take control of your own life, then what's possible? So all that to say, Medicare writes guidelines, and they say anything designed to make your quality of life better is not medically necessary, which is craziness, but that's literally in the guidelines. I put that in your packet, which I think is sadly comical, but that's just the world we live in. And let's be honest, Medicare, just try not to go broke. We're not here to solve the world's problems, right? So, all that to say, just full transparency, it's going to be out of pocket. Saves time, money, and frustration because we get clarity, which beats the guessing, but then it's usually the question I get is, well, how long does it take? And commonly with that, there's like two parts to that. If you're saying, how long does it take to feel better? That's one thing. And we commonly see people changing sometimes as quickly as Wayne, and I've seen just from the demo, they're like, oh, I felt X% better for 2 weeks until they came in for their assessment. Other people didn't notice much after a little bit because their case was much more significant. In terms of feeling better averages, month to 2 months, we're seeing some changes. It's pretty common. If you want to use the word cure, that's a different story, right? If you use the word cure, then I'm getting calls from like Potawatomi and Freeburn and and I don't know how to talk to them, right? So we don't use that word, but we've seen people getting full resolution in their symptoms. So that's in terms of time frame. How long does that take? Usually feeling better. 1 to 2 months is not uncommon to hear people reporting improvements. Full resolution, for whatever their case may be, nerves heal kind of slowly, maybe up to 1.5 years, 2 years to get the full benefit from what your body can bring back. Okay. Other questions I get then is like, well, what does that look like financially? Just to be transparent as well, 150 to say $400-ish a month. We're usually getting care plans in that range. Again, depending on how severe it is, what's going on, once we know what's happening.
So what's that based on, a month-to-month appointment? Or is that?
So we do like more of a care plan model where we go, okay, here's how many office visits you're gonna need support with. Here's the home equipment that makes sense for your case. Here's the food plan that makes sense for your case. There's all that information that's individualized. So does that help answer that one? Yeah, we don't have like a cookie cutter thing. Everybody's an individual person. We treat them with respect that way. Yeah. Any other questions on that? Those are the most common ones I get. So my main question then for you is, where are you at? Like, where's your nerve damage, and how do we assess that one? That's kind of where we're at with that one. So, yeah, too bad as manage symptoms, or let's figure out what the real cause is and make that better. All right. Here's how we take advantage of that. If you want clarity on that, instead of the 875 for both visits, you spend some time with those. So some really fun stuff with Wayne. We're doing everything for 139. So I realize insurance isn't going to cover that. I don't want it to be a big barrier for you to get that information. 139 covers both visits. Lets us know where we're at, and then gives you options for treatment moving forward. Okay. So yeah, I would encourage you to schedule that before you go. The gals will have appointment times available and get that scheduled for you. The other thing would be a big help is if you saw something fun today, got a good experience, you would zap that QR code. It'll take to a review, like a Google review. You just say, hey, learn something fun, or 2 words is fine. But that just helps us let people know, oh, wait a minute, there's some good information out there that we need not be, not everybody knows about, right? We have other solutions. We might be able to support other people. So that'd be a big help for us if this one's helpful for you today. Any questions on really anything? If it's an individual case question, I'll be here, for a couple minutes, kind of breaking things down. I don't want to, violate the HIPAA and have you tell your whole story right now. But if there's anything generalized questions for going over today. Okay. Certainly welcome. You learned something valuable.
Yeah.
Saw something really cool. I was really fun. I was like, that always blows me away. Thanks for being here. I'm really glad you came, and hope to see you guys soon.
All right.
All right?
Thank you.
Yeah. All right. Applause. Got us there.
I do have a question.
Yeah.
The
Oh, yeah, you did that.
neuropathy,
Sure.
the cause of it is chemo. So this helps with like chemo effects.
Yes.
Or is chemo one of those like the bullet that destroys it?
So, yeah, chemo blows it up, but frankly, chemo's one of the easier ones to treat.
Okay.
Yeah. I mean, assuming everyone else is, handled, but if you're on chemo still, then it's like that's more of a management.
Nope, chemo is over remission.
Lost that on one.
Oh yeah, flatnet. 15 million is a maintenance.
Okay.
Live maintenance.
So, I mean, yeah, we might have to have that discussion on what's, out that is it, what's possible, but, honestly, that's common with easier ones to work
It
with.
is common. Oh.
Yeah.
I heard, like chiropractic adjustments can also help.
And it's specifically neuropathy or chemo-induced. I mean, I'm a chiropractor, right? By virtual training, it doesn't do much, to be honest with you.
Okay.
Yeah, I'm not saying it's not valuable, but in terms of like working to reverse neuropathy, that's not the main thing. Unless you got a disc that's actually, that's the main driver. That might be a component. But in my experience, that might sound weird coming from a chiropractor.
No,
But that's
the
the
opposite.
truth.
I didn't say, yeah, you need it.
Yeah.
Just charging me another.
No, exactly. Like that's not what we're about. Yep.
One of his MRIs, they did say that he had a compressed.
Okay.
I'm not saying that's going to fix the neuropathy, but is that something you could look at?
Yeah,
Maybe.
exactly. And so again, if nerve flow is a problem, we do need to address it, and there might be things we might need traction instead of an adjustment. Like there's other ways to make that nerve happy besides just moving bones around. And so depending on what that looks like, we can have that conversation.
I won't do anything.
Yeah.
Thank you.
You're welcome. Yeah. And it looks like you got a lot on your mind.
Thank you.
You're welcome, Heather. Thanks for being here.
Thank you.
Give me 1 second here, buddy. You can give us a ring at 717-285-0001 and look forward to seeing you soon. Have a great night.